Okay, so hello everyone. Today I will be your reporter and we will be talking about antihistamines. So this will be a comprehensive overview of our topic for today, and now let's proceed with our objectives. So first, our objectives are a mechanism of action, which understand how different histamine receptor blockers work. Number two, we have the indications. In here, we will be identifying approved and off-label uses of various histamine receptor blockers. The third one, we have the adverse events and contraindications. In this part, we will be describing potential negative effects and situations where antihistamines should be avoided. And lastly, we have the interprofessional strategies. So it outlines collaborative approaches among healthcare professionals, just like us nurses, to enhance patient care, treatment coordination, and communication for successful antihistamine therapy and improved patient outcomes. So as you can see here, we have our introduction on our next page. So let's define what are antihistamines. These are a class of pharmaceutical drugs, okay, designed to manage conditions triggered by our histamine activities. So histamine receptors are categorized into two classes. The first one is the H1 and the second one is the H2 receptors. So these drugs targeting H1 receptors are used to address allergies. So maybe you're familiar with it, and also allergic rhinitis. So yeah, while those affecting H2 receptors, well, these are utilized to treat our upper gastrointestinal issues resulting from excessive stomach acid. Okay, now this educational activity looks into the essential aspects of antihistamine therapy, focusing on indications, contraindications, mechanism of action, adverse events, and collaborative strategies for optimal patient care within an interprofessional healthcare team. So as you may know, I have some of the words mentioned which may not be familiar for all of us, or mostly majority of us here. So again, antihistamines, these are pharmaceutical compounds that counteract the effects of histamine in our bodies. So for histamine, well, it is a chemical mediator involved in allergic reactions, inflammation, stomach acid regulations as well. Now for H1 and H2 receptors, H1 receptor, they are primarily associated with allergic responses, meaning, the most common allergies that we have for when it comes to food or caused by the our environment. Okay, now the second one is the H2 receptors. For example, it is mainly involved in regulating the stomach acid production. So yes, the absorption of certain drugs. Yeah, we will be talking about that later on. So we also have the allergic rhinitis. Maybe you are familiar with that. Don't worry, because it will be shown later in one of the slides of our topic today. So it is the inflammation of our nasal passages caused by allergens. So then for the upper gastrointestinal conditions, it refers to the disorders affecting the upper digestive tract. So for indications, we have approved uses for specific medications or treatments. You may be able to see indications on the medications that you buy over the counter, and for the contraindications as well. You can see it in the leaflets of syrup. For example, I usually buy cetirizine. It is an antihistamine for my daughter whenever she's coughing. Yes, so yeah, it is you can see it in the package inside. So yes, now for the adverse effect or events, these are unintended and harmful effects resulting from medical interventions. So that's why we need prescriptions from our doctors. So at the same time, they are also trying to evaluate the effect of such medications. Now, for the next part, we will be talking about our FDA approved indications and examples of H1 and H2 antihistamines, as mentioned earlier. So again, this summary outlines the FDA approved indications for these antihistamines, provides examples of commonly used drugs, and briefly discusses non-FDA approved uses. Okay, so you can see here FDA approved indications for H1 antihistamines. We have the following. Okay, so first is the allergic rhinitis. Okay, I've mentioned it earlier, the nasal inflammation caused by allergies. Number 2, conjunctivitis, so it refers to our eyes, meaning it is the eye inflammation. Number 3, we have allergic dermatological reactions. So when we talk about dermatology, it is the study of our skin, right? Okay, and here we have sinusitis. It is the inflammation of sinuses. For example, my mom, my brother, and my sister, so they have sinusitis. So I believe that these antihistamines are very plays a crucial role in their body interactions when it comes to drugs. Okay, now how about no, let's have here, I'm so sorry guys. Let's continue. Okay, now how about urticaria? We have hives. So maybe some of you have here or have experienced or know someone who has urticaria. It is called hives, so they're familiar with this, and followed by our angioedema. So it is swelling, from the word edema, that is swelling. Okay, angio, it's okay, anak, beneath the skin. So now we have here our bronchitis. So as you may know, bronchitis, from the root word itself, bronchioles. Okay, so it is the inflammation of the bronchial tubes. Yes. Oh, I have skipped one part, which is the atopic dermatitis, or this chronic skin inflammation. Okay, now we have the motion sickness, from the word motion, meaning that is moving, and then sickness, you feel uncomfortable during especially when you're traveling, something like that. So that's why we have here our nausea, the feeling of you wanted to vomit. Okay, and while vomiting, that is the action itself of the forceful ejection from our body. That means we wanted to throw up something from our body. Now for H2 antihistamines, we have the following. The peptic ulcer, so it is the stomach or intestine sore, or the inflammation of our stomach lining. So maybe probably this is the most common complaints from the people we know, especially in all older people. Just like my mom, she would often complain about having a very painful feeling in her stomach. So she would most likely drink Kreml S for her indigestion. She often thinks just like that. And now for the acid reflux. Okay, this one is the stomach acid entering the esophagus. Okay, so now we have the gastritis, the gastric acid produced by our in our stomach. So stomach lining inflammation. So here, so this is also the last one, the Zollinger-Ellison syndrome, or excessive stomach acid. So there's a term for the excessive stomach acid. And now how about, okay, here let's move on to our non-FDA approved uses and dual H1 H2 antihistamines. So here, non-FDA approved uses with the following. Okay, H1 is for insomnia, people who can't sleep, okay, with the same pattern every day. So probably they would stay up late at night, just like me. I do believe that I have insomnia, though I don't know whether it is mild or chronic or acute. So yes. And the second one, we have here the H2 antihistamines, or the H2 receptor. This is for the indigestion. Okay, so also we have here a a follow-up information, which means that the dual H1 and H2 antihistamines can be used for refractory urticaria that doesn't respond to H1 antihistamines alone. So they have um, their corresponding reasons to why. Okay, so followed by refractory urticaria. I don't know if you're familiar with it, but these are hives that do not respond to standard treatment. Okay, so that's why we have to use the H1 and H2 antihistamines. So yes, and now let's have here our next page. Here, examples of the drugs. Yes, so I've made a drug study about this in our group activity, so I hope everyone is done with that. And yes, okay, for the examples of drugs, we have here our H1 antihistamines and also H2 antihistamines. So let's begin with the H1. So these are, the first one is diphenhydramine, cetirizine. Okay, this is very common for me. I often buy that over the counter. Okay, now how about the third one, chlorpheniramine, cyclizine, the dimenhydrinate, doxylamine, hydroxyzine, meclizine, and the H2 antihistamines are the following. We have cimetidine, famotidine, nizatidine, and roxatidine. Okay, so maybe we are not familiar with these because some of these are of course should be prescribed by the doctor. Okay, some are over the counter, but since we are not that knowledgeable with the drugs, so we really have to take into consideration of the doctor's order or the education that we got from our healthcare professionals. So now for the conclusion of this part is that H1 and H2 antihistamines, they serve as valuable treatments for a range of allergic and gastrointestinal conditions. Thus, while they have the specific FDA approved uses and non-approved uses and dual therapy, they can also play a role in certain cases. So understanding their indications and example drug aids our healthcare professionals in providing efficient and effective patient care, and I think that is our major priority. Okay, so let's proceed with our next page, which is our mechanism of action and administration of antihistamine. Okay, so for the introduction, let's begin. Okay, antihistamines are crucial medications for managing allergies and related symptoms. I believe this is true because, of course, if we don't know how to manage allergies, it will lead to a worst case scenario. And I'll give you examples later. And then they function by countering the effects of histamine, again, a natural chemical messenger that triggers various bodily responses. Now, this summary explains the mechanism of action, administration methods, and potential adverse effects of antihistamines. And now let's proceed to our mechanism of action. So histamine prompts increased vascular permeability, leading to fluid leakage, swelling, and vessel dilation, the widening of the vessels. So antihistamines, specifically our H1 receptor antagonists, they counteract this effect, providing relief from allergy symptoms. But that also depends. Probably it would be a short-term effect or a long-term. It depends on the consumption. Okay, now for the first generation antihistamines affect both the CNS or our central nervous system and the peripheral receptors. Okay, so these medications have varying durations of action and are metabolized by the liver's 450 cytochrome system. Okay, so there are terms here that we are not familiar, but don't worry, I will try to address that one. So for 450 cytochrome system, that is a group of enzymes responsible for metabolizing drugs in the liver. I almost forgot. I remember that ma'am said last or previous weeks in our discussion, she said that our liver is one of the most important part in our body, because it is where all the things that we consume being processed, or tigasala, yun po. And then now, for the vascular permeability, as mentioned here, where was that? Okay, there you go. Actually, the ease with which fluids can pass through the blood vessels, that is our vascular blood vessel walls. So that is our vascular permeability. Yes, okay. And now for the CNS, of course, it's very, maybe you're familiar with that. Okay, we've talked about the systems before, and well, it is the brain and the spinal cord controlling our bodily functions. And for peripheral, okay, situated away from the center of the body. Okay, so now, how about here? Let's proceed to the administration. So, antihistamines are typically, okay, this is the route. We're talking about the route of administration. So, there are various routes. So, now let's begin with typically taken as oral tablets. But there are some individuals who can't swallow the tablets. That's why we have different drug forms. We have the suspension, we have IV. So here in some cases, so in IV, intravenous, IM is intramuscular. Administration might be used. So specifically for inpatient treatment of specific conditions. So now we have these methods are employed to address severe allergic reactions to other medications. And now, thus, we conclude that antihistamines play a vital role in managing allergy reactions by countering the histamine effects, as I've said earlier. So we have to understand their mechanism of action, the administration method, and potential adverse effects. Enables us to, of course, implement a better patient care and informed medication choices. So now we have a few more slides, so I hope everyone is still there and paying attention to our topic for today. And now here, let's move on to the adverse effects, contraindications, and monitoring of H1 and H2 antihistamines. So as you can see, adverse effects. So H1 antihistamines, or the first generation H1 antihistamines, particularly can cause anticholinergic effects such as sedation, dry mouth, insomnia, dizziness, and tinnitus. While higher doses may lead to euphoria, impaired coordination, and delirium. So some antihistamines have the potential for cardiotoxic effects, including the QTc prolongation. Okay, so let me share with you some of the a sample scenario here. Okay, so let's say, for example, we have our adverse effects, right? So if someone takes a first generation antihistamine, well, they might experience dry mouth or drowsiness, feeling sleepy like that, so making them feel like they need to drink water and take a nap. So that's the adverse effect. Yes. So if you may see here also, it says here that we have the cardiotoxic effects. It means it refers to the harmful effects to our heart. Yes. And what else? A QTc prolongation, I believe that that is the abnormal heart rhythm characterized by a lengthened QT interval on an ECG. Maybe you're familiar with that. ECG is an electrocardiogram, which can lead to serious heart rhythm issues. So that's why we should really monitor the adverse effects. Okay, so now we have the contraindications. For contraindications, we have here patients with, oh, I'm so sorry, I skipped H2 antihistamines. Let's get back here. So H2 antihistamines generally well tolerated. So they might cause rare issues like gastrointestinal changes, fatigue, dizziness, and confusion. So this is less it's a less threat to our body. And here for the contraindications, I believe that I've mentioned this several times already. So patients with QTc prolongation or abnormal heart rhythm as antihistamines can exacerbate heart risk. So that means exacerbate, which is already bad, makes it worse. Okay, now pregnant and lactating women, so we really have to protect them because, as you may know, we have an MCN subject, maternal and child care. So yes, because we are not only caring for just one individual, but two or even more if the patient is of course pregnant with twins or a lactating mom. So now here it is due to the potential to the fetus or breastfeeding infants, as I've mentioned. Now individuals with impaired renal and hepatic function should use antihistamines with caution. So we don't just take medications or be the doctor of our own, be a doctor on our own. So you see, our renal function, from the word renal itself, it is related to the kidneys' ability to filter waste and regulate fluid balance, and hepatic related to liver's ability to process toxins and metabolize drugs. Okay, now one example for contraindications is that a patient who already has heart rhythm issues, okay, and they should avoid antihistamines that can potentially worsen, exacerbate their condition and lead to dangerous heart rhythms. So yes, lastly we have our monitoring. So for the monitoring, we have here dosing of antihistamines, especially during prolonged use. So probably that should be monitored because we know that the effects of medication is not stable when it is prolonged. Now number two is the patients, particularly the elderly, because they have they are considered individuals who have the most sensitive health conditions. So thus it should be monitored for anticholinergic effects like dizziness and falls. Okay, so we wouldn't want to commit any mistakes while we are implementing the interventions as nurses. And now cardiotoxic effects can be monitored through ECG, or ECG is the electrocardiogram to assess the QTc interval or prolongation. That's the abnormal rhythm. Okay, now I believe that for monitoring, give me a second. If I can remember, if a patient has been taking antihistamines for a while, well, the doctor might want to regularly check their heart rhythm because that's important in the ECG to make sure that the medication isn't affecting the heart in a harmful way. So that's one of the considerations that we have to put into our minds. And thus the conclusion for this is that understanding the potential adverse effects, the contraindications, and the need for proper monitoring of H1 and H2 antihistamines is crucial to for providing safe and effective patient care. So healthcare professionals must consider these factors to ensure best outcomes for their patients. So that's our top priority. Okay, now let's have our last slide, if I'm not mistaken. So we have here our antihistamine overdose, healthcare team collaboration, and patient outcomes. So here we have toxicity and antidote. So yes, toxic and antidote, which is the cure. So as you may know, and maybe you're familiar with it, so antihistamine overdose lacks a specific antidote. Well, in cases of toxicity, the physostigmine might be considered, particularly if delirium or other adverse effects are due to anticholinergic effects. So if you can remember, I've mentioned anticholinergic effects earlier. So yeah, I wanted to share with you some of the here. So physostigmine, what does it mean? It is a medication used to counteract anticholinergic effects by increasing the acetylcholine levels in the brain. So acetylcholine, it has a major function. That's why, okay, it is very important in delirium, which means it is a state of mental confusion and agitation or anxiety. Okay, now, so number 2, we have the collaboration for patient outcomes. So H1 antihistamines are divided into 2. The first and second generation targeting allergies again. The next one is H2 antihistamines focus on reducing the acid stomach or the stomach acid and treating conditions like acid reflux and gastritis, right? Okay, so now, if I can remember, if someone accidentally takes too many antihistamine pills and start experiencing confusion and hallucinations, okay, so physostigmine might be used to help counteract these effects by restoring normal mental function. Okay, that's the purpose. Okay, so for collaboration, patient outcome, probably a patient suffering from severe allergies might see their the doctor who prescribed or the allergies, the doctor who prescribes the first generation H1 antihistamine. They will communicate with the pharmacist who provides medication and dosing instructions for the patient to know. For the patient to know or be equipped with the knowledge, okay, and the patient also have to interact with the nurses so that they will help them. It will help them understand the potential side effects and monitor their progress. Okay, so now, interprofessional team collaboration. So basically those are us, pharmacists, nurses, doctors, and etc. But probably these are the most important. Okay, so for pharmacists, they sell and educate patients about antihistamines, guide proper dosing, and warn about potential issues. But yeah, sometimes when we buy over-the-counter medications, we don't really wait for the pharmacist to educate us. We just buy them right away, and then because we already have been told by the doctor or the nurses, yes, something like that. And nurses, they educate patients about antihistamines and then monitor their effects, communicates with doctors if necessary for adverse or side effects. And now doctors, well, they prescribe the appropriate antihistamines, especially for older patients, and collaborate with pharmacists to ensure the safe medication use. Okay, so I guess they are antihistamines are valuable medications when used correctly, but overdose can lead to toxicity. So yeah, the collaborative efforts of pharmacists, nurses, and doctors within an interprofessional healthcare team are essential to ensure the patients receive the right medications, proper dosing, necessary monitoring, ultimately enhancing patient outcomes and safety. So I believe that is all about my report for today, and thank you so much for listening. I hope you have learned something, and also I'm really grateful to our professor, because at first I really don't have any idea. I really didn't have any idea about this. Maybe I'm just familiar with cetirizine, which I usually buy in the drugstore for my daughter whenever she's sick. So yeah, but now I believe that there are other classifications, what are the indications, and I've equipped my knowledge, and it will be really useful in the future as a nurse. So that would be all. Thank you so much for listening. Have a great day.